All right. Well, thank you everybody for joining us for the July Snotrac partner meeting. We're going to go ahead and just introduce ourselves very quickly, and to expedite that, I'm going to read off your name, and then if you could say your organization, that'd be great. To make this go a little faster, if you could go ahead and unmute yourself now, and then as soon as you say your organization, you can go back on mute if you so choose. So I am going to go down the list alphabetically, I think. So starting with Aaron Morrow.
Good afternoon, Aaron Morrow, public policy advocate, King County Mobility Coalition, along with others. And I'm also a newly appointed HopeLink board member. I'm glad to be here. Thank you.
Thank you, Aaron. Ben Kramer.
Ben Kramer, Homage Senior Services.
Great. Bree Boyce.
Hi, happy Friday. Bree Boyce, use she, her pronouns. I'm with the HopeLink Mobility Management Team, Program Manager of Coalitions.
Brian Brink. Maybe Brian hopped off. He was on here. Brian, I never get your last name quite right. Brian.
Snecko?
Yeah, thank you.
Yeah, Brian Snecko, Ever Transit.
Thank you. Casey Stevens.
Casey Stevens, Still Tribe, Tribal Planner.
Chris Pecori.
Bethany at Silver Lake Skilled Nursing Facility.
Great. Dean Sidnor.
Dean Sidnor, he, him, pronouns, Rare Coalition with Hope Building Management.
Great. Jean Kim.
Jean Kim with Puget Sound Regional Council.
Kim Pearson.
Kim Pearson, Puget Sound Regional Council.
Lee Spruce.
Lee Spruce, ARC of Snohomish County Advocacy.
Great. Mariana Hannafeld. You're mute.
I got it. Yeah, sorry. Northwest Region Community Liaison. Hello, everybody.
Great. Megan Dunn.
Megan Dunn, Snohomish County Council member.
Let's see here. Michael, let's see. I misspelled your name when I wrote it down, but Michael Glonner.
Hi, Rock, that's perfect. Michael Glonner with Snohomish County Long-Term Care and Aging.
Great. Someone by the name of Note Taker. Well, we can come back. It may also be a phone of some sort. Sharita Stewart Burrell. You're somewhere there, Sharita. Shanita, sorry, Shanita. And then finally, well, I got two more. Stephanie Novacek.
Hi, I'm Stephanie with Snohomish County Long-Term Care and Aging. We're the area agency on aging for Snohomish County.
Mary Wysocki.
Good afternoon, everyone. I'm Mary Wysocki. I work up in Darrington with a collaborative called North Counties Community Collaborative, and I work with families who are low income and marginalized up in that area. Thank you.
And Megan, did I skip you somehow? Megan Dunn?
No, you got me.
Okay, good. I lost track. So this is great. I'm going to share my screen to go over our agenda real quick. And it's going to help if I'm on the first page. So just in case you're new to the organization, Snotrac advocates for connecting people and communities in Snohomish County and beyond with safe, equitable, and accessible transportation. Our agenda for today is mainly our presentation from PSRC on the update to the Coordinated Mobility Plan. And so we have a great presentation coming from Jean Kim and Kim Pearson. We will provide I will provide an update on the final recommendations from the Darrington Mobility Study and what our next steps are. We will have a roundtable as we always do. And I thought we would break it down into certain subjects. So a lot of this will be duplicative when I go through, but I just want to make sure that we're cognizant of our mission and hitting all of our transportation modes, the target populations we have, the geographies, and the sectors that are priorities for us under a strategic plan. And then new to our partners meetings is we will tack on a discussion that typically happens through the rare Snohomish County meetings, but to discuss emergency management. And that'll be led by Dean Senor and Bree Boyce of HopeLink. And I've just listed a couple of things, but I think their actual agenda is slightly different. We're hoping that this will help ensure we get a little bit greater participation in the emergency management, which is critical at critical times, and also help reduce redundancy that we have in our meetings. So with that, I'm going to just, I think, hop right in to PSRC. So I'm going to stop sharing my screen, and Kim, you can share your screen.
Yeah, so while Kim is pulling up her screen, good morning. Again, my name is, not good morning, it's good afternoon already. My name is Jean Kim. I'm an associate planner with the Puget Sound Regional Council. I'm joined here by Kim Pearson for this presentation. Next slide. So today we'd like to provide a really brief presentation on the work we've been doing to update the Coordinated Mobility Plan, formerly called Coordinated Transit Human Services Transportation Plan, or Coordinated Plan in short, which is part of the larger Regional Transportation Plan. So we will share the key findings on mobility needs we are hearing from communities from the public outreach and online survey. And this is part of our ongoing updates to the mobility coalitions, and we will continue to provide more periodic updates throughout the plan update process on this topic. Next. So before we start our presentation, I would like to provide a few bullet points, a couple of bullet points to give you some context on this topic. So specialized transportation services refer to mobility options available for people with special transportation needs, including older adults, youth, people with disabilities, people with low incomes, and other populations in the region. And examples of these transportation options also include ADA paratransit buses, shuttles, vans that typically require booking a ride in advance, and volunteer driver programs, which are often free or donation-based, provided by volunteers who dedicate their time to really assist the people with limited transportation options. So Kim and I both are going to use these terms on this slide frequently throughout the presentation today. Hopefully this provides some context for you all. And we, PSRC, is a metropolitan planning organization for 4 counties in central Puget Sound region, including King, Kitsap, Pierce, and Snohomish County. Our agency plans for both regular transit and specialized transportation and all their active transportation modes like bicycle and sidewalks, pedestrians. And we also work with stakeholders in the region to fund those programs. So we develop regional transportation plan that identifies the long-term regional transportation needs. So ranging from the needs for improved sidewalk connectivity, access to transit, including bus, rail, and ferries, to the needs for new transportation technologies like ride-hailing. And to really update the regional transportation plan, we work with counties, cities and towns, transportation agencies, and the public to update this plan. This plan is updated every 4 years to meet the state and federal requirements. So if you have any questions on the regional transportation plan, please feel free to unmute yourself and ask questions. I'll just wait for another 5 to 10 seconds for you to observe all this information. So hearing none or seeing none in the chat box, I'll just go over, move to the next slide. So the coordinated mobility plan is part of the regional transportation plan. And we also update this plan every 4 years to meet the requirements. And as mentioned, this plan particularly addressed the mobility challenges of people with special transportation needs and prioritize strategies to address those identified needs. And to identify the needs and strategies, we PSRC staff reach out to older adults, youth, people with disabilities, and people with lower incomes to really identify their key mobility needs. The plan also addresses the mobility needs of veterans and people with limited English proficiency who may have transportation challenges to get to the places they would like to go. We also use the coordinated mobility plan as a basis for prioritizing the state and federal funds like consolidated grant for specialized transportation programs. So as you can see on this slide, our core major populations of concern for this plan are older adults, youth, persons with disabilities, people with low incomes. And as of 2019, nearly half of the region's population fall into at least one of these population groups. And to provide a little more details in our region, so 4-county region, the fastest growing group is the older adults over 65 years old. And they will grow from 15% of today's population to 20% of the 2050 population. Aaron, I see your hands up.
Jean, you can go on with your presentation. I'll put my comments in at the end.
Okay, sounds great. Thank you, Aaron. Yeah, next slide. So this slide provides a list of 3 goals of the coordinated mobility plan. We retained the 3 overarching goals from the current coordinated plan, but we slightly revised the explanations of each plan to align with the state HSTP goals and to more clearly address what the goals are for. So the goal of the plan is to put the people first, to improve quality of both regular transit and specialized transportation services for people with special transportation needs, and to move people more efficiently through the seamless transportation network in the region. And finally, to move more people with specialized transportation services available in the region to help more people to get the places they need to go. Next slide. I believe that was the last slide for my portion, and Kim will present the outreach that we've been doing and the summary of the community outreach and the online survey.
Yes, thanks, Jean. So we've been doing a variety of activities to learn more about mobility needs of people in the region. And so I'll go through what we've heard so far via our work to field a survey, our work to do outreach with different community groups in the region, as well as a tool we have on our website, our engagement website, to collect stories from people who use specialized transportation. So first off, I'll talk about the RTP online survey. As you can see on the screen, this survey is currently available through the end of August and is translated into 6 languages. And so far, over 1,000 people have responded to the survey, with over half of the respondents answering additional questions about specialized mobility needs And so we asked people to answer these questions if they wanted to answer the questions if they or someone in their household has special transportation needs. And so 52% of people responded to those questions. And then 12% of those, of all people who responded, said they or someone in their household uses or would use specialized transportation in the near future. So as mentioned, the survey is open now and we will have final results by early fall. So please share the survey around and we'll have more information on how to do that towards the end of the presentation. Next, we have been doing coordinated mobility plan outreach, and our goal is to hear lived experiences and feedback on mobility needs from people in the region. And we reached out to over 80 organizations and met with 12 community groups. And we finalized the first part of our outreach process at the end, in the end of June. And we plan on starting our next phase very soon. And basically how it's worked so far is we had virtual engagement, which includes a short presentation on the regional transportation plan and the coordinated mobility plan. And then we did Mentimeter polling. So Mentimeter is a live survey. We did that. And if not the Mentimeter poll, we had a conversation with people about their mobility needs. So it was an interactive discussion, and on the right, you can see some screenshots of what we heard from people when we asked about challenges they experience for regular transit or specialized transportation. And also we will continue attending mobility coalition meetings like this one to keep you apprised of what's going on and also develop strategies to address the needs identified through these meetings. And so Jean will talk more about that a little bit later. So here is a list of some of the groups we've met with. They range in variety of, the type of people who are part of those groups and locations of the groups. And we hope to continue working with them going forward, but also branch out to different groups. So we'll be sending another round of invitations for outreach shortly. So for the second phase of outreach, we hope to reach out to even more groups. In terms of our results, we have compiled feedback on the top mobility needs from the survey, so from the RTP online survey, as well as our outreach meetings. And so far, some of the top issues identified for regular transit are lack of services at times they are needed and long travel times, for example. And one anecdote we heard was that there can be long wait times at transit stations, which can cause people to miss medical appointments. So this is just a list of some of the top 6 challenges we heard, most common challenges we heard for regular transit. And the next slide will cover specialized transportation. So some of the top issues identified for specialized transportation include a lack of information about available services, as well as a lack of physical infrastructure to get to and from services, which means that some people can have difficulty getting to and from drop-off locations. And by physical infrastructure, we are referring to sidewalks or curb ramps and other physical infrastructure. Additionally, as part of the overall regional transportation plan outreach, we have been doing youth outreach and meeting with middle school and high school students to learn about their priorities and their vision for the transportation system. And between March and June, staff joined up with youth commissions and organizations in Arlington, Edmonds, Issaquah, Pierce County, and Bremerton via Zoom. virtually for a brief presentation on the transportation planning in this region, as well as 2 interactive exercises and a group discussion. Some highlights from our discussion on youth's frequent destinations are that a lot of youth are walking to their friends' houses and nearby parks, especially during the pandemic. But youth also mentioned some key challenges or barriers to accessing further destinations or destinations that are far away. So some of these included the location of bus routes and stops, the perceived safety of biking or taking transit by themselves, as well as difficulty driving and parking in denser areas like Seattle for those who do have driver's licenses. Finally, as you may have heard, and as I just mentioned, PSRC recently launched a new engagement website called engage.psrc.org. And this is where you can find the Regional Transportation Plan survey, the online survey, as well as our last or one of our other key pieces for outreach is a tool called the Specialized Transportation Stories tool. And there anyone can share stories of using specialized transportation. And this tool, you can use this tool to upload text, photos, audio, and other forms of media to tell about people's experiences using specialized transportation. And so we hope to use these stories that we receive in the coordinated mobility plan to provide further context about what people are experiencing. And so please share this around with your contacts. And now I'll turn it back to Jean for next steps.
Yeah. The little arrow. And this is the final slide. So for the next steps for the coordinated mobility plan update, we will be developing and prioritizing strategies and performance measures. So based on the key mobility needs we identified throughout the outreach and the online survey process, we will update the strategies and examine updates to really how to prioritize the strategies and how to organize or communicate it, including identifying the implementers like PSRC, jurisdictions, or state or other. Categorized by time frame, so long-term strategies versus near-term strategies that is achievable within 4 to 5 year time frame. And we are planning to work closely with the Special Needs Transportation Committee, one of our advisory committee, and mobility coalitions like Snotrac, Raret, and others on developing and revising strategies to address the needs from probably next week through September. So we'll be back to Snotrac for further conversation on the prioritized strategies and further refine the strategies. And also we'll continue our outreach to the communities to confirm their desired outcomes and strategies to improve mobility within their communities. And then the final step would be to develop performance measures to really track performance of both transit and specialized transportation programs. So at the next week's Special Needs Transportation Committee meeting, we will introduce the potential approach to update the measures and metrics for the updated plan to track performance of the different specialized transportation programs, including operations, capital to purchase vehicles, mobility management, including travel training, and other mobility coalition functions. And I also want to remind all of you that we will use this information in the plan as a basis for the regional priority ranking evaluation for the consolidated grant project starting next year. So this plan update will definitely affect the potential changes in the call for project materials and the regional priority ranking factors for the consolidated grant within King, Pierce, and Snohomish counties. So please keep in mind that we and you will be both using the plan as a basis for the upcoming grant evaluation. So that's it for today. I know we have a minute left for discussion, but if you have any questions, please feel free to unmute yourself.
So Gina, I'll just jump in here and thank you for your presentation. Your outreach team, including yourself, have been working diligently and very hard to get this community survey out and get as much feedback as you can. So my comments, and I'll keep it brief, I'll keep down to about 3 bullet points. They're more policy questions or what I want to convey to the policymakers. Paratransit's always going to be a key role in getting people to where they need to go. But I really think it's about choice. It's about community choice. It's about flexibility. And I think as we look into the future, we really need to continue to advocate to the policymakers about good land use decisions in their individual cities. You made a point with the youth not having, stops close by. They're having to walk to their friend's house. So I think that's key going forward, so we can utilize, when you talk about choice and different ride options like Uber, Lyft, and whoever else wants to come to the party. I think the transit landscape's changing. So yeah, those are my comments for now. I appreciate it. Thank you.
Yeah, thank you for your feedback, Aaron.
I have a question regarding the surveys. So surveys have been out for a little while. And so I was promoting them very heavily or I don't know heavily, but I think they were in like 4 straight newsletters from me. And so I dropped them off eventually because like this has to end at some point. But are you still receiving input via the surveys? Like you mentioned, both the RTP survey and then also the stories that are coming through.
Yeah,
so
the RTP.
What's the window? Yeah, how long are they going to be open?
Yeah, so the approximate deadline for the RTP online survey is by end of August, and the stories tool will remain open until the plan got adopted. So we will be sending out another email to all the organizations, including mobility coalitions, starting early next week on the reminder, with a reminder on the online survey and stories tool. So we'll just keep going, but the online survey will be closed by end of next month.
And I guess one more question, unless somebody else wants to jump in here. So where the rubber hits the road for the coordinated mobility plan, I think, is mostly with the coordinated grants and the evaluation of them in terms of how it can meaningfully impact actual programming or policy in the region is through that. Is there the potential for, since it gets incorporated into the RTP, and I think the RTP is being published before the next round of the comprehensive plan updates, that cities in our county should be looking towards a coordinated mobility plan and incorporating certain policies into their comprehensive plans?
Yeah, so we'll be working with jurisdictions to provide the data within the coordinated mobility plan, and also other transit data or active transportation related data sets included in the RTP. So we will work closely with jurisdictions, and our visualization tool is already up online, and that provides some of the base data for the comp plan updates, but we will continuously update any information or data points later this year.
So a quick follow-up. So in addition to the data, is there any expectation that cities should also be looking at the prioritized strategies within the coordinated mobility plan, or is that mostly just left up to our organizations who get funded by the coordinated grants?
I can get back to you on that.
Okay.
Yeah, but definitely the consolidated grant applicants should review the updated coordinated plan that'll be adopted next year, May of next year. So before the prioritized ranking process starts in fall, for sure.
Aaron has another question.
So one of the things that I'm concerned about in the long term is the cost. As we know, there's an income disparity in Washington State and in King County and in other counties. What I'm concerned about at some point, you know, paratransit, King County paratransit, the cost is very low, which is good because it allows people with fixed incomes to utilize the service. What I'm concerned about is maybe at some point, the cost of the fare may go up. And I'm concerned that that's going to affect a lot of people, or a lot of people with disabilities from a regional perspective, people in King County not being able to go across regionally into Pierce and Snohomish County. So it's something that again, I don't know if it's been captured in your feedback. But yeah, that's a concern of mine. Thank you.
Yeah, funding and resources are always the discussion, key discussion topics, and we'll be addressing those within the strategies section of the plan.
Any other questions before we wrap up this presentation? I want to thank Eugene and Kim for coming and presenting. I think we were on the front end of your big wave of presentations that are happening to the Mobility Coalition. So maybe we're a good test run for your presentations. But thank you so much. Yeah.
Thanks for having us.
Thank you.
And of course, please stay. So, all right, I'm going to share my screen again. Our next agenda item is the Darrington Mobility Study. And I'm just going to do a quick screen share of the report. I thought I had shared it in the calendar invite, but it looks like I had not. So if you did not receive it, I'll be following up with an email to this meeting to make sure you have the report in hand and you can see it. But I'm going to flip back to my slide deck and I'll provide an overview of the recommendations and findings in the report. Just kind of a quick overview. Happy to have discussions and answer questions about it. And then our next big discussion about next steps will actually be next Tuesday with the North Counties Transportation Coalition. So know that a longer discussion will still be had. Let me share the new screen. Okay. So the Darrington Mobility Study, its purpose was to identify potential solutions to known mobility gaps that existed in Darrington. Part of that is just to reaffirm what those gaps were. So the study just confirms several things. First, the existing gaps there's obviously limited fixed route transit service between Darrington and Arlington. Community transit provides AM and PM one route each day. And the Soxhawtl tribe, who operates the DC Direct, provides neither service between Darrington and Arlington and provides no weekend service. And CT also, community transit also does not provide weekend service. There's also no paratransit or door-to-door services that includes community transit's DART service because the line is considered a commuter route and not a local route. And no TAP for it. So no transportation assistance program, paratransit service operated by Homage. Potentially with additional resources that can be expanded, which is part of the solutions. There's also limited medical, non-emergency medical transportation services, very limited on that front. The other finding from the report based on the survey is there's a general lack of knowledge of what limited services do exist. And so there can be improvements just on that. The study also found a clear desire for having better connections to Arlington, whether it's for work, school, and related activities or medical appointments. And potentially also shopping, although I'm not sure that that popped up in the survey. There's also, I'm not sure we would have gotten this absent the survey, but a clear desire by people who live within the greater Darrington area, so like the school district of Darrington, to have better mobility options into the town of Darrington itself. And finally, I'm just mentioning this here because we brought this up a couple of times, and relative to the other services we surveyed, this was actually fairly strong of a desire to have, or an interest, I shouldn't say necessarily desire, is listed here as desire, but an interest in having a transit service that's focused on recreation, similar to in King County, the Trailhead Direct program. Ultimately, the report made 5 recommendations. First was to add a local flex route transit service to serve the greater Darrington area. So this would be similar in concept to what will be piloted this fall in the Camino Stanwood Arlington connection that we worked with on the Lincoln Hill Retirement Community, formerly the Stanwood Community and Senior Center, of where you have a fixed route, but you can schedule in advance to have the service pick you up at your door and deliver to where you need to go. And this could be operated by a number of providers, according to the report. Second is to add a Darrington to Arlington fixed route service. And this could be just 2 things. One is just simply to add 1 midday trip, round trip to the Community Transit 230. Or 2, to have someone else provide all-day fixed route service. The Soxwell tribe has expressed interest in having another line that goes from Darrington to Arlington. So with additional resources, that might be possible. And the experience from the Snoqualmie Valley Transportation program is that you can do that at less expense and be able to operate more service by using a non-traditional provider, like a nonprofit, as opposed to a public agency. The other here is, I might have these numbers a little bit backwards, I think, because I think number 3 should be number 2, but is to adjust the route of the 230 timing, adjust route 230's timing. So that way somebody who lives in Darrington can actually work a full shift in Arlington. Right now, that's not possible. And so by having the bus come a little bit earlier and a little bit in the morning, a little later in the afternoon or evening, will make that possible, and would be a really big thing for people who are making that commute. Fourth is to improve education and marketing. Based on the survey, there is a lack of information about the service. There's also just some basic operations of the DC Direct that make it difficult for people to understand when the bus is coming, where to go, and how the transit systems of like the DC Direct and the Skagit Transit and Community Transit all sync up to one another. And so having materials like a map that's focused for the Darrington area, having actual bus stops for DC Direct. Maybe it's some of the back end technical training for the Soxwell tribe to be able to operate the system in a way that makes it a little bit easier and intuitive for the residents to use. And finally, for paratransit service, obviously there is currently no DART, no TAP. And so the report calls for kind of rallying political support for that service. And that's needed. So we need to make the case for our argument of, how much is it going to cost, and have the leaders be able to express their support. And the report suggests having a sign-on letter to do that. Make sure we have funding for it. Next steps, as I mentioned, we will continue to take the recommendations from the report and try to implement them. There is some refinement of we got the report, now we need to figure out, okay, yes, we need to increase fixed route transit service, but who does it? And what would that look like? Who are the partners we need? And then having funding and ultimately implementation of it. And our next meeting is Tuesday. So if you'd like to join that, let me know. If you don't, so you can get the Zoom link if you don't already have it. With that, my little slide deck is done for Darrington, so I'm happy to take questions that people might have. I know Mary is on the call, so if there's something Mary would like to add, feel free to jump in.
No, you and I had a meeting this morning and reviewed it, and I just want to thank you very much and the tool group for making this happen. We are all very encouraged by the recommendations and the fact that we have concrete things that we can start working on to fill in some of these gaps. But again, I want to make sure that I thank you, Brock, and then also the funding source that allowed us to do this study.
And certainly a thank you goes right back to Mary, because so much of bringing the people together and the conversations were not possible without Mary. And she's brought a ton of needed energy to this project and facilitation of the project. So thank you so much, Mary. Okay. Everybody's so quiet. I might have to force everybody to go off mic just so we can have extemporaneous conversations. Okay, so next is our roundtable. So this is just a great opportunity to learn what each of us are doing and what's coming up. This is also an opportunity to find what gaps and opportunities exist within the community. And in our strategic plan, which flows directly from the region's regional mobility plan, or sorry, coordinated mobility plan. It is the prioritization of priority population groups, geographies, and also sectors of certain things we want to work on. So from that, I'm going to go through, and a lot of these end up being duplicative, and that's okay, but I'm going to go through section by section of kind of our transit agencies, which is the traditional way we've done this. And then we're going to go through a couple other layers and just make sure there might be nothing that we need to address within a particular geography, and that's fine. Maybe we don't have anybody from that area to be able to raise something, but just be able to go that list helps us make sure that we're covering our bases. So that first, our traditional of going through kind of our agencies. So I'd like to start, I guess, with Everett Transit. It's because Brian is here. Brian, do you have an update from Everett Transit?
I don't have a lot, Brock, but the only thing that I can talk to is, as you may or may not know, that Tom Hinkson, our director, presented kind of the final results of the study, the Rethink Transit study, to council. And then part of that was determining council to take the next step, and they decided to move forward. There was some discussion on if they would just kind of put that hold, because the city's also redistributing its districts, so they're going to have different council members. But they decided to move forward with the council, so they're putting together a steering committee, which they're working on, that'll kind of give them some more direction. And basically the results Tom Ray presented was that that came out of that was the city wants more transportation, but not really sure how they want to provide that and how they're going to fund that. So that's kind of the gist of that they do desire more, but what that looks like and how that's funded, not sure. And so they basically have a steering committee that, and I apologize, I don't know if that's been put together or if that's still in the process, but they're going to work with the council to kind of determine what all that looks like. So that's kind of the big thing that's going on from us. At this time, we're also looking at an increase in service coming up in the fall, where we're putting some routes back and some more service is going to be happening in the city of Everett also.
Yeah. It looks like Aaron has a question for you, Brian.
Thanks, Brian, for your recap and update. Can you have Brock send out the link to the report that you're referring to, please?
Yeah, Aaron, I can do that. It was a report to City Council, I want to say a month ago now, Brian.
Yeah, it was in June.
Yeah, and I'll just again recap. I was actually a little surprised by how much Tom laid in terms of the into the recommendations of from tool design was also Nelson Nygaard was the consultant for that. So there were 3 scenarios that the report looked at. One is to continue with the existing funding that Everett Transit has, which is a 0.6 sales tax. And the second was to increase it by 0.3. And the third was a merger with community transit. The study found that there would be a marginal gain in terms of it would be an improvement in transit service to increase from 0.3 from what is currently 0.6, but to go to 0.3. But there's a number of complications that made it so that you wouldn't get as much as you would hope, and that a complete merger, and probably more importantly, the 0.6 of going up a full 0.6, but also some of just like the operations of already having existing buses allowed deployment more quickly with a merger potentially. And so you saw a bigger jump in the service that would be provided under a merger. There's a lot of complications with that, with any scenario. And so it would the city administration and council has made it clear that they would want a vote regardless of which they proceed forward with. And so that the council requested the Citizens Advisory Committee to be formed. And I have a feeling that it's starting to be put together, but I don't think it's finalized yet, as Brian mentioned. And so they'll make the final recommendation, or they'll make a recommendation to City Council on how to proceed forward. I think Tom had hoped that conversation would start next spring, but council wanted to start it right now. So that's where we're at. I think the soonest it would be on the ballot would be fall of 2022, but it could be fall of 2023. So. Yeah, I think that's probably enough of Everett Transit. Just a couple of updates since CT and ST aren't on the call right now. So for community transit, they recently got funding for their Orange Line from the feds, and they are starting their long-range planning process, which happens every few years. They had their first workshop with their board yesterday. Sound Transit continues down its realignment planning process. Just yesterday, their financial analyst improved the budget picture for Sound Transit. Originally, it was like an $11.5 billion shortfall estimation as of, I believe, January or February of this year. It was slightly smaller last summer, then it went up. And then they had a revision earlier this spring to about 7.9 or 7.8 billion. And the current revision has it, I believe, at 5.8 billion or something like that. So we're progressively getting a better budget picture. The realignment planning process in terms of like thinking about the scope of Sound Transit and delaying projects had pegged the decision for July 2021, so this month. They just had their board meeting yesterday, and they didn't make that decision yet. No, sorry, they're having their board meeting next week. I'm getting my timetable off. They're having the board meeting next week. They're not going to make the final decision whether to do realignment next week. They're actually going to do that 2 weeks later, but they're going to consider several amendments to a proposal next week. And so things are progressing on that front. I'll say that the leading proposal that's being championed by Snohomish, by the chair of the board and by our representatives on the Sound Transit board would delay Everett Link extension, the final termination in Everett, from 2036 to 2042. It would break it into two segments. The first segment, which would be from Linwood to Mariner, would be delayed from 2036 to 2038. And so I'm not sure everybody's on board with that, but that's where our electeds are at on that, who represent us on the Sound Transit board. Sound Transit also recently received, I don't remember the exact dollar amount, but they received federal funding for the Linwood extension. So that project, which I think is already under budget and a little bit ahead of schedule, is doing well. And Sound Transit also recently entered into a partnership with Amazon, who will be providing some funding for affordable housing at ST2 stations. So at the stations potentially up to Linwood, for example. I got a briefing from Sound Transit yesterday about that, and I think they only have one site that is pegged for a potential affordable housing project using that money, and that'd be in Linwood. So those, I think, are the main updates from Sound Transit and from Community Transit. I see a bunch of things are happening in chat and I'm not even looking here. Yep, so thanks, Mariana. Next, is Ben Kramer still on the line?
Hi, Brock, I am.
Yeah, can you provide an update on TAP?
Yeah, right now, I think one of the biggest things we're working on is we're looking at hiring a couple people, probably 1 to 2 in driving positions for right now, and another dispatcher, as we're looking forward to making some of the changes that we had planned on with the new biennium starting. So pretty excited about that. Looking at some other changes that we planned on to serve some of the areas that are underserved right now, and maybe we're looking at how to do that exactly. Possibilities include having a certain day that we went out to certain areas. Monroe is definitely an area we're looking at that we're already serving. However, the need out there continues to rise. So we're looking at how we can serve more people and do it more efficiently. So right now, I think that's about the only TAP update I have.
Great. And then I don't know if we have anybody from DART, whether it's Community Transit or TransManage on the line here. All right. Any updates from those who provide medical transportation, whether it's Medicaid or other services? Okay. Any update from travel transportation? I think Casey might be the only one. I think Casey Stevens still online.
Yep, I'm here. So the only thing we would have to report is COVID is gradually going away and our transit drivers are more active. They can actually pick folks up on demand type of thing. So that's a huge improvement over the last from 6 months ago. Other than that, we have broken ground on our road improvement, and I know this is generally transit-based organization, but we are doing a road improvement between Interstate 5 and our reservation. So we have about 2,700 linear feet that's that we're working on right now, and by next year, probably 16 months from now, we'll have the entire corridor improved. That's 1.2 miles. And the point I'm making is that we will have a mixed use path. So locals for the first time ever will have a safe place to walk because there's a 1920s road that has no shoulders. So we're anxiously looking forward to having better access for pedestrians, kids. We've had good feedback from the locals on it because they can go anywhere unless they get in their car. So
that's very good.
That's all I have to report. Thank you.
Yeah, that's a very rural road out to your buildings and facilities out there. Mariana might have a question for you. So
Just a really quick one. Hey, Casey, have you hired for the transportation director out there?
Yes, Travis Newbury. He has a background in aeronautics. Yeah, he's a very well-spoken guy.
What's his
Travis
last name?
Newbury. I'm sorry, Travis Duxbury. Newbury is another employee. Travis Duxbury.
Yeah.
He's more of a military and hardware background, but he's well-spoken. He's a very capable guy.
Okay, perfect.
Travis is his name.
Could you, Casey, could you shoot me off an email with his contact information?
Sure, you bet.
Yeah, I appreciate it.
Okay, thanks, Mariana.
Well, Casey, you just did the next two bullet items, so that's good. But I just want to make sure that we cover all of our transportation bases here. So I have a bullet point for auto infrastructure and another for bike walk infrastructure. I can provide it quickly an update for Mukilteo is going to be doing something for Fifth Avenue near their, down in their city center. So they currently have an online survey for a bike ped project that they're doing. Does anybody else here know of planning or infrastructure projects that are happening in the county that they want to make sure we know about? All right, there'll be many other opportunities. And finally, I just added a bullet point for comprehensive planning and land use activities that are happening. Obviously, Aaron, who needs to jump off, already brought this up, but this affects in terms of how far somebody has to walk to be able to get where they need to go, or how they need to get between two places. All the cities and the county will be updating their comprehensive plans over the next 2 years. And so this will be an opportunity for us to help influence them. That's as much of an update I think I'm going to be providing, unless somebody else here wants to talk about something about a comp plan update. Stephanie from the county might have something that she wants to add, or Megan just had to drop off. So Megan done. Okay. So next, I just want to make sure that we cover particular population groups as we think about it. So these are our target population groups according to our strategic plan: tribes, rural areas, low-income populations, English as second language, people of color, older adults, youth, people with disabilities, non-emergency medical transportation needs for people who need that, and veterans. I think this is going to be slightly different. It can be both updates as to like, if you represent those groups, here's something that is in my community. So like Alex, if there's something coming up with Center for Independence that you want to raise, or Stephanie, if there's something around low income populations that you want to raise. I know you put something in the chat around food services. So anything like that could come up here. So I might just call, well, I'll just list a bullet point and I'll pause. And then if somebody wants to add something, they can add something. Otherwise, I'll move on. So I'll start with tribes. Casey, is there any opportunities or gaps that you'd like to see addressed here?
No, other than we've been so isolated for a very long time. We generally just communicate between Snotrac and something called the Washington State Tribal Transportation Planning Organization.
Yep.
And if anything, it's been a real problem being able to meet with people face to face. The sidebars we found as important as the meetings. So online, I mean, it kind of works, but you really have to have the breakout groups face to face, and that's been a real, I guess, a problem. So like everybody else, we've been on hold, but one of our challenges, our partner tribes or our sister tribes are, there are 29 tribes and they're spread throughout the state as opposed to just within the county. So I guess that's been isolating, I guess would be an issue, but it's, we're coming out of it, and so it's a good thing. And I guess that would be all I'd have to say, unless somebody else wants to say something about the tribes.
Well, hopefully we'll get Natalie and potentially a couple of people from the Tulalip at future meetings so we can build out, and hopefully the same with each of these population groups as we go through. So I don't know if anybody wants to speak up, but for any of these as I go through the rest, some of these I can identify somebody to ask, but others I won't be able to. So for that particular situation, I have that with rural communities or just rural areas, any particular emergent issues that people want to discuss or make a comment about. Okay. Amy. Yes, Amy Biggs with Snoqualmie Valley Transportation.
I always have something to say about rural, Brock.
Yeah.
Rural is my jam. So one of the things that I don't know, Brock, if you had a chance to share what you got from the Snoqualmie Valley Mobility Coalition at all?
No, we haven't. No, there hasn't been an update from SVT. So, or SVTC, SVMC as it now is.
Yes, we're just a whole mess of letters. So one of the things that we have been working on for a couple of years is something that Brock was in on when we started to initially look at it, which is there a way to create a baseline for rural transit? And if so, what would that look like? So in terms of rural, we are talking to King County Metro to see all of the cities signed on to, and the tribes signed on to a letter to go to King County Metro to let them know that the measurement systems that they have don't work very well for rural areas. And so we don't really have geographic equity. And so we are trying to create a baseline for rural services that could potentially, if it works, could potentially be adopted in other areas.
Yeah, that'll be really helpful. It is a matter of equity to make sure that we have an efficient as transportation system as possible, that people who need to use transit disproportionately use it, and therefore, the ridership is based on that. So you need to make sure that you're doing it on efficiency base and not just trying to geographically say we're all equal. But there has to be a baseline from an equity perspective, because if you don't have a baseline of transit service, then you don't serve that area. And that's a very inequitable way of doing it. So yeah, I'm excited about your work within this, the Snoqualmie Valley to do that and to push King County set a baseline. hopefully something we can learn. We're in a little bit different situation because community transit doesn't serve the rural area. So it's hard to set a baseline for them.
Well, it actually really is. There's 70,000 people living in Snoqualmie Valley, and it's 1/4 of King County, the land miles of King County. And we have one metro bus that goes to Duval and one that goes to North Bend, Snoqualmie. And it only runs like every 90 minutes to 2 hours. So,
yeah.
And there's really nothing in the way of weekend service. So
yeah.
When you've developed a regional system that you need a car to be able to utilize, it's clearly something's a little broken.
Yeah.
So that's what we're trying to address.
And yep. Okay. So let's go on to the next population group, low income. Are there emergent issues around transportation or other things, service provision that somebody wants to bring up?
This is Stephanie, and I'll just say something that touches on low income, ESL, and older adults. And that is what I put into the chat about the Senior Farmers Market Nutrition Program vouchers, where someone over the age of 60 or who is 55 years old with a tribal affiliation can, if they don't make more than 185% of the federal poverty level, they can get a voucher for $40, and then they can go buy fresh fruits and vegetables at the different farmers markets and farm stands around our county. And although those aren't, equally distributed, there's fairly good coverage. And this program also has a consideration for people who can't do their own driving, either because they don't have a car or they're too old. Someone can shop for them if a proxy form is filled out and signed. And what I also just wanted to mention is we have applications available in multiple languages. And if you follow the address that I put in to the website or you call us, we even will get interpreters if someone calls us. This happened the other day. Somebody called and had questions and spoke Ukrainian. So we found someone who spoke Ukrainian to get back to her. And working on this program, first of all, Michael and I are working on it. And if you guys could help us give away these last 300 vouchers, we could actually work on transportation issues again or consider them. And then it does just emphasize for me how the whole question of food insecurity is tied to our transportation system in many ways. This is only a small program, but it just brings up, like, can people go out to get their own groceries? No, they can't because of transportation or often because of money. And, how are you going to balance and account for that? Oh, and then the other thing is if some of these same people who got this voucher are also on SNAPs, or what we used to call food stamps, several farmers markets will also match if you spend up to $40 a day on EBT food stamps or SNAP, they will match you. So that's another way that people can get more fruits and vegetables. So I'll be quiet about it, but it is what's pretty much occupying my mind, and it's occupying 3 or 4 people at our program full-time at the moment. So thanks.
That's great. Thank you, Stephanie. And certainly we learned during the lockdown last year that food delivery was critically important, and a bunch of our providers transitioned to that.
Yes.
We just a couple of ideas, maybe. The paratransit services, not Everett Transit's paratransit serves older adults without regard to disability. And so you might be able to Brian might be able to send out a note, or the communications manager for Everett Transit might be able to send out a note to the paratransit subscribees about the program. And I'm sure Homage might be able to do that as well, but you're probably already in conversation with them.
Yes, we are, but in conversation with Homage, but I didn't think about paratransit. So thank you for that idea.
Yeah. DART doesn't have only older adults, so that's certainly certainly they have older adults within the list, but it's not one of the criteria. So, well, let's jump to, I'll call it, but just in case there's another issue that came up with folks with English as a second language, any emerging issues that we need to address, or people of color? Okay. Other issues for older adults? Youth. I'll say I now participate within a county transition network that focuses on youth in particular with disabilities, and that has been eye-opening to learn about their particular issues, often relating access to school. So hopefully we can continue to build relationships there. People with disabilities?
This is Alex, Center for Independence. Hello.
Hi, Alex.
You know, what's happening is really the isolation as well. I know we spoke spoke on that earlier with tribes. That's what we have been experiencing before the pandemic, but obviously even more during the pandemic. Isolation has been a very big factor with us with the transportation. So we're continuing to just trying to provide resources and try to figure out how to navigate through the barriers. But things are getting better. So, you know, we see a light kind of at the end of the tunnel, but we're still focusing on that in regards and just making sure it's the transportation that's available, you know, is accessible. Working with, obviously, that's why I'm here, you know, working with everyone here and but just, you know, providing that on one-on-one. And the isolation is huge. I think that's like one of the biggest things, not just for getting back and forth, like just, I mean, obviously getting back and forth to doctor's appointments like that's one thing. It does provide a little bit of getting out there, but you know, that going back and forth to visiting friends and family, not able to because of COVID, but also the transportation restrictions, which is understandable, had to be done. But that's kind of, I guess what I can share. So thank you.
Yeah. Have you shifted? Is programming shifting at all within Center for Independence or within, I don't know, Lee's, I think still on the call, might still be on the call too, with ARC. Are you providing services in a different way to address the isolation issue or any other issue that might be coming up?
Yeah, this is Alex. Slowly we are we just had a youth group meet together and they all were able to meet in the office. But it's slowly happening with that transition back. And it really has a lot to do with what the participants are comfortable with as well. The youth were all for it. They're ready to get back and get in and start meeting. And so they had an event outdoors. But yeah, slowly but surely, we're looking, Center for Independence is looking to hopefully be back to the way we were doing operations prior by September. It's kind of what our timetable looks like. So it just all depends on how our county looks. I mean, things are looking good still, so that's a good thing. But yeah, slowly but surely we're getting back. But we are, our youth transition conference in August is going to be virtual still. So it's a weird kind of hybrid thing going on still.
A number of jurisdictions have been updating their ADA transition plans, which are their plans for improving like sidewalks or even access into public buildings, that sort of thing. Lee or Alex or anybody else, have folks been tracking that? I've been sharing the couple that I've seen within Snohomish County, but have folks also been tracking and weighing in on those.
I think anything that I've seen is just the issue is still being discussed. And no, as far as I know, no plans have been implemented. I know Anna Zevarts is still trying to push for addressing the issue with people.
Yeah,
So-
the Port of Everett and the City of Everett have been going through an update process for their city ADA transition plans. I believe other cities are doing it as well. So I just
Mhm.
wanted to check that.
I think it's kind of a slow but steady wins the race kind of
Yeah.
approach to it.
Non-emergency medical transportation. So folks needing medical transportation, any emerging needs, maybe HopeLink might have some insight, although I don't think we have necessarily the right folks from HopeLink on this question, but. All right. And then finally, veterans. Somebody from, not sure if somebody from Catholic Community Services is still here. Yeah. Next, geography. So again, we don't have to weigh in on each one, but if there's something happening within your geography that you want us to know about, it doesn't have to be tied to your organization per se, but just something that we should be aware of. So I've kind of broken this up as best as I can into different areas. First is Stanwood Camino. What I'll say is the Lincoln Hill Retirement Community, formerly Stanwood Community Senior Center, is launching the new service that we worked on this fall. They picked a name. They officially have picked Snow Goose Transit as the name of that service. They're coordinating with Amy Biggs, who you already heard from, about how to roll out that service. Any other updates from Stanwood Camino or needs, issues that you've seen up there that you want to bring up? Okay, next, Arlington, Darrington. We already did the report. Any other issues within that area that folks want us to be aware of? And this could be anything from roadway projects to, to our paratransit services. So anything. Marysville, Lake Stevens, Snohomish, Granite Falls area. Monroe, Sultan, Gold Bar, Snoqualmie Valley. Everett. Oh, yeah.
Oh, just something about kids. I don't know if you announced it on this meeting, or maybe I did previously, but we have this program that's called Summer Freedom, and all kids 18 and under can ride free on all the buses all summer long. It makes things easier on working parents, and it gets kids to programs that they might have missed otherwise.
That's fantastic. So that's free transit for kids on SVT buses.
Yep.
Awesome. That's really cool. Mariana.
Hey, I'm sorry, I should have mentioned, jumped in at the Snohomish Junction. I met with the city of Snohomish folks last week, and they are talking about putting together either a trolley for the business districts to join the 2 business districts, but also they are talking about a demand responsive potential part to that project. And interestingly enough, they have a group of stakeholders that are really willing to fund this thing. So it'll be very interesting to see where that goes. I think you'll need to be aware of it. And Brock, I think I looped you in, but for those of you that are on that side of the county, that's going to be very, very interesting. Amy, you might be interested in that little project as well. So they're really, WashDOT isn't going to be able to fund them at least for another 2 years, but they're going after some other grants and community support. So they're even looking at an electric vehicle. So kind of an interesting development.
Thank you, Mariana. That'd be great. Right, updates from Everett Mukilteo. I already mentioned one for the bike ped project that's happening. Any other updates folks want to share?
So yeah, just the isolation part really quick, Brock. Both All Aboard in June 21st, they opened their program up limited, and then they are actually going to fully open here. I think they did last week, and then Full Life on Monday is doing a very limited reopening. So adult couple social settings and adult day health are opening back up in Everett. So people are getting out a little bit more. So we're really good to see that.
Great. It's nice to see society opening back up. Any updates from the Linwood, Edmonds, Briar, the less known community, Montlake Terrace area? Updates from Bothell. We did have somebody from Bothell join us for momentarily at the very least.
This is Sherman.
Yep. Hey, Sherman.
Hey, city transportation planner. So I'm just trying to remember what we just received some project grant. I believe it was, I want to say it was for the Bothell Way project, but I could be wrong on that. We're all just getting back into the office. And kind of on a regular basis. I guess the main thing is that City Hall is is basically reopening now. So if people have, for services and whatnot, they can come into City Hall now. So.
And Sherman, where are you at with your bike master plan?
We are drafting the text for it and wrapping up some of the design standards for the ultimate design part of the plan, which is we're calling part B.
Yep.
And part A being the implementable, annual project plans, and then the ultimate plan. We're kind of waiting for a consultant to finish those. And trying to wrap that up. So it's a process.
And your consultant is Nelson Nygaard? I forget who it is.
No, we're working with two. Primarily is Tool Design Group is who we're working with on the plan itself, and then we're working with Transportation Engineering Northwest on some of the technical stuff, like the details, the standard detail drawings and cost estimates and things like that. More of an engineering approach, just because we want to have more than a planning level cost estimate. We want get a better idea of what that's going to cost on projects.
Your approach has been really sharp, I think. So I like what you've done so far. Yeah. I'm looking forward to actually digging into it once this version is out.
That's why we're trying to write it up perfectly so people can understand it better.
Sure.
Thank you.
All right. So finally, just kind of our connections into our neighboring counties to the north, Skagit and Whatcom County. Anything folks want to bring as potential issues that have been happening of connecting to the north? And any connections folks want to raise for connecting to the south? Obviously, we've already covered some of it with Amy and Sherman. I guess one thing, this goes back to the ST3 realignment discussion. I already mentioned the timeline adjustment for Everett Link extension. There would also be an adjustment to the the bus rapid transit service that Sound Transit will be building, which is called Stride, and the 405 alignment, and it too would be delayed. And in part, it might have to be delayed anyways because WashDOT's project for building new hot lanes on 405 looks like they're being delayed. And so Sound Transit doesn't feel the need to push forward on its project as quickly as it had planned because WashDOT won't be done with its part. So Last slide on our discussion here, and we've kind of covered, well, this is kind of the gist of it, but in case there's anything we didn't bring up through these lenses, these are our priority sectors. I've actually added one today, just make sure we address it. Are there any issues that folks have had and that been emerging or you want addressed around community centers, senior centers, food banks? Any issues regarding affordable housing and shelter? I know in Everett, we have a new 21 pallet shelter facility near Everett Station. And I'm not sure if they're having transportation issues, but it's a new facility, so there might be new potential things happening there. Okay, healthcare and social services, any particular issues folks have been seeing? We don't really have anybody from university colleges here or from K through 12 schools. And we've covered tribes. Any particular issues folks have seen with job access and workforce development? I know we're having a hard time making sure that some of our employers have enough staff. I don't know. I don't think that has to do with transportation to and from work. Maybe some of clients folks work with, you might have seen some issues around transportation.
Brock?
Yep.
In our area, this is actually being, the lack of access to transit has been huge for the businesses in Snoqualmie Valley, because depending upon where people are, they have their businesses, if it's too expensive for the workers to live there, then you need transit from the areas to where people can afford to live to the businesses. So this is the lack of access to transit for us has been really huge.
Yep. And certainly this is Darrington is a big issue for this as they grow and have the new Wood Innovation Center. So I'm going to try to do this each partner meeting to be able to make sure we're covering all of our areas, and we can and generally make sure we have a well-rounded roundtable potential of things that are happening in our community. And just know that if there's something that's coming up, pay attention to it and plan to bring it to the next partner meeting as something that we can address. With that, our Snotrac partner meetings official agenda has wrapped up. We do have our emergency management meeting now. So hopefully our friends from HopeLink are still here and can jump into that. These are Snotrac's next meetings. So we have North County Transportation Coalition meeting next Tuesday, speaker forum with Anna Zeiberts on July 29th. And then in August, the dates for executive committee meeting and our next our emergency management conversation that would follow. Snotrac partner meeting in September, so in 2 months on September 17th. With that, I will stop my share and thank everybody for joining us for our partner meeting.
Thank you, Brock.
Yeah,
Thanks, Brock.
absolutely.
It was
Dean's going to take it away here and start his session.
Thank you, Brock. Yeah, I appreciate everyone that sticks around and here for this quick update. I just want to provide kind of a quick primer of like what this is and maybe a recap for folks that maybe haven't attended a ton of the meetings for exactly what rare it is. And we'll post some resources in the chat to kind of explain that. Essentially, if you've been to some of our recent regional monthly COVID-19 check-in meetings, you might have heard me articulate the fact that we're looking to transition a lot of those meetings into a different format or change them or sunset them, kind of depending on the regional needs and what mobility coalitions want from Merit. So for example, in King County, due to a lot of duplication with task force meetings we have, those meetings have just kind of ceased. And while in Pierce County, they've rebranded essentially as just more of a generalized meeting and kind of broadened in scope. Here in Snohomish County, we found working with Brock, we found that maybe the best path forward is to kind of integrate better with Snotrac meetings, provide supplemental check-ins towards the end, where we can cover some of the emergency related topics through the lens of providing services to folks with access to functional needs, the elderly, people with limited English proficiency, and so on. So that's kind of the goal of why I'm here today, and why you'll see meetings like the Rare Snohomish County check-in that's scheduled for next week probably change in format, like date and time, the length of them, and so on. So that's kind of a primer to explain what's going on if you're familiar with these meetings. If you're not familiar with what Rare is, or if you haven't been there in a while, just a quick recap, and I'll post in the chat here a quick introductory PowerPoint that we created to kind of make sure folks kind of understand what we do and what we're all about. So you'll find that in the chat if you take a look and you want to know more, or just have that saved so you don't forget what Rare does. Essentially, Rare, it's the Regional Alliance for Resilient and Equitable Transportation. The idea is that through our coalition of emergency managers, transit agencies, community advocates, public health, and many more partners, that we can pilot key strategies to increase critical transportation services available to populations with access and functional needs, including many of the groups that I mentioned just a moment ago, in the event of emergency in the Puget Sound area. And that's going to include Snohomish County, King County, and Pierce County. So that's kind of the idea. Some of the day-to-day things that we do are send out weekly updated announcement emails, provide these kind of these more localized meetings, host larger region-wide meetings that delve into a couple topics, and we'll talk about what the next one of those meetings will be about, and kind of throw out some requests for that here in a bit. And among other things, we participate in some earthquake preparedness exercises like Cascadia Rising and the Cascadia Subduction Zone Plan updates as an example of something we're working on right now. But yeah, that's a quick overview of kind of what Rare does and why we're having this talk right now at the end of the Snotrac meeting. This is going to be just a quick check-in. So, I know Brock said, hey, maybe 30 minutes at the end of the meeting. If we don't hit full 30 minutes, that's not kind of what these are about. We're just going to provide basic updates on a few key topics and answer any questions or emerging needs that might be brought up. And if there aren't any, then we'll just call it a wrap and send everybody on their way. So to get started really quick, I think the two big topics that I know Brock mentioned that he wanted us to get to were some COVID-19 updates and probably a bit on smoke and wildfire preparedness. So there's been some big developments in the past month as far as COVID-19 goes. As many of you were probably already aware, Snohomish County is engaged in kind of a winding down and closing of its mass vaccination sites run by the task force. That's been announced a while ago, and if you've kept in touch with any of our updates, it's probably something that you've seen. Today was actually not today. The 13th was also the last iteration of the county's kind of YouTube series that they've been releasing with Dave Summers and Dr. Chris Spitters and some of their other colleagues providing their responses, a full video about their response to COVID-19s. These briefings have been kind of a way to keep up to date. With the kind of changing landscape, it seems like they, unless I misunderstood what they were saying in the video, it seems like they're going to start winding those down as well. I posted the link to the video in the chat here for folks that want to view it themselves. It is a bit long, so I've taken some notes from that to kind of highlight some of the key points for Snohomish County's COVID-19 updates. Essentially, the way that the county is focused on it is they're kind of transitioning from a state of pandemic response to building up infrastructure for recovery. There's still a lot unknown about COVID-19, but through this pandemic, they built a lot of flexible systems that are in place to adapt to new challenges that might be posed by variants or increased COVID-19 challenges in the fall. They did mention that, while they have wound down these sites, should the landscape kind of change, they've distributed resources across the county in such a way that if, let's say in the fall, a need arises where, they need an increased vaccination effort or a need for boosters becomes recommended, which that's not the case at the moment. They can communicate it broadly and then quickly set up infrastructure to provide, some version of mass sites that they're currently winding down. So it's not some sort of permanent decision that they won't be able to flexibly reverse or change or alter should the situation arise. It's just the plan at the moment. Kind of reiterating the fact that COVID's not a completely done and dusted situation. They highlighted that new cases and new outbreaks are happening. They cited an example of through the week of the 4th through the 10th of July, 384 cases were recorded, which is a 36% increase from the previous week. And they think that it's likely that, especially with the Delta variant kind of rising in prominence, that we'll be seeing further upticks as the weeks go by. So COVID is not gone, and it is still spreading. Preventative measures like vaccinations are the strongest tool that we have to fight it, while masking and social distancing recommendations for the unvaccinated are still in place. So that's why we'll also be seeing this mandate for mask wearing on public transit persist through September 13th, per the recommendation of the TSA. So those were a couple key points from there. Let me take a look and see if they had anything else. At the moment, they quoted about 425,000 have been fully vaccinated, and basically in the county, about 2/3 of those who are eligible have begun their vaccination program. So significant progress has been made there. Testing, the need for testing has fallen drastically from its peak, as a lot of case rates have gone down as well. Routine testing is still something that they see as a desirable commitment to maintain to the county. So at the moment, they plan on keeping their Everett and Linwood testing centers online. And if that changes in any way, obviously, I think they'll announce that. But at the moment, that doesn't seem to be in the cards for those closing, if this video is anything to go by. But that's basically all of the updates from Snohomish County in their video. Additionally, and I'll post this in chat for you as well, on the July 14th, the Department of Health released a newsroom update on Washington State as a whole, crossing the 70% vaccination initiation milestone. So for folks getting at least one of their doses, we crossed that particular threshold, which is great news. But again, a lot of the same precautions in that article about sustained caution and the fact that reaching these important milestones while encouraging isn't any sort of indication that COVID is no longer a threat or not something that should be taken seriously. So that's a few of those COVID-19 updates. I'm going to move on to some smoke and wildfire resources that I want to distribute in chat. Did anyone have any? Again, I'm not a public health expert, but if folks had questions about it, I can definitely relay those types of questions to some of our public health contacts and try to get those answered for you. Was there anything that folks wanted to mention or add to what I've said so far, or if there's any corrections if I may have stated something that they're aware of? I'm not seeing anyone jump off of mute. But again, if I misspeak in any way and folks have contrary information that they want to bring up, or if there's any questions that they would like us to forward to some of our public health contacts, please let me know and we'll try to get that taken care of for you. So don't hesitate to jump out and stop me if you think I'm not framing things accurately. So generally, one of the key types of emergent crises we'll probably have to contend with regularly in this coming season will be wildfire and smoke preparation. For us here in Snohomish County and King County and Pierce County, the smoke will probably be the most universally dealt with obstacles. So a lot of the resources I'm going to share are going to be focusing on the smoke from these wildfires. I'm going to post a couple articles here in the chat from Public Health that kind of provide a basic overview of some of the risks of smoke and a couple recommendations on how to take steps to protect oneself. In chat, you'll find a link from the Snohomish Health District, which touches on both heat and quick bullet points on smoke. I'm also providing, it's a pretty generalized article despite coming from King County. It's a public health insider blog from Seattle King County Public Health, which kind of outlines how to get smoke ready and kind of outlines why this is a threat. I think one of the biggest takeaways is that while from our coalition, it's a great concern because it's unhealthy, particularly for vulnerable populations like children, pregnant women, stroke survivors, people over the age of 65 with respiratory diseases or illness, heart disease or diabetes. Those are some key populations that are affected by this issue. And as a coalition that focuses on serving the needs of folks that might fall into some of those categories, preparedness for it is a top concern. It is important to note that, especially for transit employers or people that employ anyone, even folks that might not fit into those categories that folks would typically think of as vulnerable, that one, as mentioned in the Seattle King County Public Health article, one group that suffered more health impacts last year was young, healthy people between the ages of 20 and 30 years old. Purely, it seems, as the article states, this is the group of many of which continued to be active outdoors during the days of smoke. So one key reminder is that even if you don't fall into one of those categories of vulnerability that were kind of outlined, smoke is unhealthy to anyone, no matter what your age is or your health status. So if with that in mind, how would one know that the air quality is at a certain level that they need to be taking precautions? Well, thankfully, as I'm sure many of you are aware, Puget Sound Clean Air Agency provides a neat little tracker update, of which I'm just provided a link in chat, that allows you to select your county, select your activity level, and then outlines if sensitive groups and healthy adults should be making any adjustments or taking any precautions. That same group also provides a wildfire smoke kind of document about precautions that should be taken, similar to what was already there for the health departments. But again, that's a supplementary piece of information for folks that want to use the same website as is the alert. So there's a couple resources there. Public Health recommends that people check that link for the advisories if folks are unsure about the safety level of the air in their county. That's the best place to check beforehand. Additionally, there are some other resources that I am going to get posted here. Sorry, give me 1 second while I get these up for you. For folks that work in office spaces, particularly like transportation agencies where you have dispatchers in a room, for example, or some other staff that are facilitating your product but might not be piloting your vehicles. The EPA has actually released guidance on how to create a clean room to protect indoor air quality during wildfire. So that kind of maybe outlines some tools or strategies for preparing your indoor facilities for the event of smoke in your area. So additionally, if you're looking for tools on top of that, the Washington State Department of Health also has produced a smoke and wildfire toolkit. Again, these are a lot of links that I have in chat, so I apologize for people that don't love to have links piled on them, but there's just a lot of resources that I think are appropriate to share. I think the toolkits, this last link in there, and this will be the last link that I post, I promise. is probably one of the most useful places to check for just general smoke and wildfire preparedness documents and information resources. One key thing that I think people should look at is there's one in English and Spanish called the Face Mask Fact Sheet, which kind of outlines and provides pictures about what type of face masks folks should be obtaining for wildfire and smoke, and how they should use that face mask. Essentially, what they're recommending is N95 masks with two straps to secure it to one's face. As a lot of people will probably look at their surgical masks or their cloth masks they've been using for protect themselves from the COVID-19 pandemic, and might assume that those are adequate for wildfire smoke. Per the Department of Health, that's not advisable, and they would recommend these N95 masks being worn as instructed on that document. So I would recommend checking out that toolkit, grabbing that, printing out a couple of those face mask how-tos and getting those, or providing that PDF to your organizations and distributing that in an email, making sure that everyone knows how to keep themselves protected during this time. Anyway, that is a bunch of information I've just shouted at you for wildfire and smoke preparedness. Anyone have any questions or anything that I have misstated and wanted to correct just off of that information, or any thoughts or comments? Okay. I'm once again not seeing anyone jump off mute, so
Hey.
I'm gonna... Hi, Brian.
I guess I don't know if we have everybody on the call, but it's something that is correct for this call, but for this discussion. But I would be interested to hear from, and they're not here, but Community Transit, Everett Transit, Homage, I know Ben's still on the line. If there's things that you're doing in the transportation vehicles themselves to ensure the air quality is okay, or that the drivers feel comfortable, like the things that you're doing to take actionable steps to make the environment better, or what you're thinking of. Dean certainly went off, listed some things for that, and for like call centers and things like that, that you would have for paratransit. So I guess Brian is here. But if there's any, we now seem to face the smoke season every year. It's been here for, I think, the last 3 years. Certainly Eastern Washington is experiencing it right now. Canada is experiencing it.
Hi, Brock.
Yeah.
Yeah, this is Ben. So we've had some conversations about this. Right now, mask-wise with drivers, they're still, we're providing the N95 masks, and they're still wearing them for COVID anyway, inside the vehicle when they're transporting. The other thing we've discussed is for our vehicles that do have cabin air filters, getting oh my gosh, it's gonna skip my mind right now, but the higher quality HEPA air filters. Unfortunately, the buses don't have any type of filtration or anything for the AC from the outside. They don't come with them. But there have been some discussions on that, but no decisions have been made quite yet.
Yeah, a lot of the measures from COVID will be helpful in terms of like the masks and the filtration systems that have been installed on the public transit agency buses. But one of the strategies for COVID on buses was also just like open the windows. It's not something you want to do during smoke season. I'm curious also from like Stephanie here, whether you're starting to actively think about how to meet the needs of people of like low income populations, of I know sometimes when days have been especially bad, like City of Seattle has opened up a public facility so that way people can come into a space and feel that they can breathe clean air. We did that with the super hot day that happened. Was it just last Monday? Where public spaces were opened. So that way people could be in air conditioning. Any proactive thinking right now happening in Snohomish County on that front for lower income households?
You know, I'm not aware of any, but I can check and talk to the person from our department who is more active on the county emergency management, different committees and work that they do. You know, that makes me think our former director bought a huge amount of PPE, personal protective equipment for COVID because our clients couldn't get hold of it. And then also people who had like respite home care workers, those workers were not being given personal protective equipment either at the beginning. So she spent a lot of time and got some donations and also spent some money. And now that a few more people are coming back to the office, we're getting some grief because we have boxes of it taking up the conference room. We have to some of our contracted partner agencies, we tell them that they can make requests of us and we fill those requests whenever we get them. But that actually would be a good, the ongoing wildfire and just air quality issues would be a good reason to go ahead and still get at least the masks out. And then again, I'll try and ask other people at the county what is being thought of. I know that in a lot of ways, they've sort of relied on other cities and other institutions like libraries and senior centers to open up. But I know right before the heat wave was getting ready to hit, I was worried that there weren't enough of those in Snohomish County. And and that maybe there needed to be more. So yes, I will ask about that.
Lee, you popped on too.
Yeah, going on the N95 mask, one of the things that I see, particularly in my community, is a lot of individuals particularly with IDD, have a lot of sensory issues. So wearing anything that blocks their face or even like face shields or face coverings is something that a lot of people have addressed as being very uncomfortable and very frightening for them. They really have a lot of fear of, it's uncomfortable to wear them, and why are we being forced to wear them on the buses and everything, a lot of backlash. I'm wondering if there's any way we could come up with implementing a plan to educate them about the safety of wearing something like that, and that it is a good thing to do. I've tried to think of things and I can't to be able to communicate back. I've tried to communicate with individuals and just got a lot of pushback on it. I'm not one of those people, by the way.
Yeah. Stephanie, this might be something to bring up with the public health, with Snohomish Health District about public messaging on that front.
Yeah, I can do that.
Yeah. This ends up being a transportation issue in part because, well, if a facility is open that has clean air and we need to get people there, then we might need door-to-door service for it or something like that, and we need to be part of the solution. The other is we just got to walk from place to place, and whenever we're outside during the smoke season, we've got to wear, well, some of us have to wear masks in order to get around. So it all comes back to transportation becomes a piece of it no matter what. I'm gonna have to go here in a moment here, Dean, but so I'm gonna turn it back to you.
Yeah, no, I I think we're wrapping up. But I think it's a good point about communication is extremely important when it comes to mask wearing. And also I think it should be acknowledged that even folks that may have, they might not be comfortable with masks entirely, but they've adjusted because obviously, it's a safety matter and they've adjusted to wearing it for COVID, but they might not have been wearing N95 masks. And N95 masks are harder to breathe through than, your run-of-the-mill surgical masks. So even folks that have been well adjusted, that might have not been enthusiastic about wearing the mask at first, might during smoke season have a set of problems they didn't have during COVID, because the mask and wearing an N95 versus wearing a surgical mask is not the same type of feeling. And for folks that get anxious when their breathing is obstructed, it might present some issues. My reading of some of the public health documents were for those that can't wear the N95 masks for whatever reason, they do just recommend finding a place to stay inside. One recommendation that I saw in those are using some of the cooling shelters. I don't know about which cooling shelters are open. I know that Snohomish Health District still lists their cooling shelters on the front page when you click on the heat warning label at the top of their website. And one of the first links you see is a list of their cooling shelters. It seemed like those cooling shelters were recommended as kind of doubling for clean air shelters. So for folks that aren't necessarily able to be home or at work or have a space where that is providing clean air, based on my readings of those public health documents that were distributed, seems like the cooling shelters are a destination that folks should consider if they have no other options.
I'm going to have to go, so I can stop and then make you a co-host if you want, or we can wrap up altogether. But
I'll just do one quick plug. There will be a bigger discussion on the 28th at the work group meeting where it's hosting, where we'll have public health transit agencies